Okay, folks, I've got discussion A for you. We're going to discuss the medications that Medicare just reduces the price on. So here we go with the presentation for y'all. Please join me in tonight's presentation A. Medicare reduces prescription meds. Okay, here we go. Medicare beneficiaries will see major price reductions on 64 prescription medications starting this year. These savings come as part of a broader effort to make essential medications more affordable for seniors enrolled in Medicare. The price cuts are expected to save beneficiaries thousands of dollars, helping them access treatments for conditions like cancer, osteoporosis, and substance use disorder. The reductions are tied to a provision in the Inflation Reduction Act, which penalizes drug manufacturers for raising prices faster than inflation. As a result, some Medicare recipients could see savings ranging from $1 per day to over $10,000 per day, depending on the medication and their coverage. All right, next page. This initiative is part of a larger push to lower prescription drug costs and ensure that Medicare enrollees can afford their medications they rely on to maintain their health. If you're interested in full list of affected drugs, you can check it out here. This resource, these price reductions have a significant impact on Medicare recipients, making crucial medications much more affordable. Here's how. Okay, guys, lower costs. Beneficiaries will save thousands of dollars on essential prescription. Some could see savings of $10,800 per day, depending on the medication and their coverage. Improve access to care. Seniors and individuals with chronic conditions like cancer, osteoporosis, and substance abuse disorder. Hold on. Gotta straighten these out. Okay. substance abuse disorder will have better access to life-saving treatments without facing financial hardship. Financial relief. Many Medicare enrollees struggle with high drug prices. These cuts help ensure they don't have to choose between medications, and other essential expenses. Legislative protection. These reductions stem from the Inflation Reduction Act, which penalizes manufacturers for price hikes faster than inflation, preventing sudden increases in drug costs. Okay, this incentive is a major step toward making healthcare more affordable for millions of Medicare recipients across the country. If you'd like more details on the affected drugs, you can check out the information msn.com, guys, on the resource page for MSN. Okay. Next page. Give me 1 second. This big win for those who rely on Medicare. What are your thoughts on the Medicare price cuts affecting 64 prescription medications, including treatments for diabetes, heart disease, and arthritis, and blood disorders? Here are some of the notable drug impacted. Genovia diabetes drug, 79% reduction. Nuvalog, diabetes, 77 or 76% price reduction. Farxiga, diabetes, heart failure, kidney disease, that's a 68% price reduction. Enbrel, rheumatoid arthritis, psoriasis, 67% price reduction. Jardiance, diabetes, heart failure, and kidney disease, 66% price reduction. Okay, that's just the start of this list. Give me a minute, guys, and I'll give you the rest. Stelara is for psoriasis, Crohn's disease, ulcerative colitis, 66% reduction in price. Exitero, it's a blood clot prevention, 62% price reduction. Eliquis, blood clot prevention, 56% price reduction. Acero, heart failure, 53% price reduction. Okay, Embevika, blood cancers. This is a 38% price reduction. These reductions stem from the Inflation Reduction Act, which penalizes manufacturers for raising prices faster than inflation. The savings range from $1, like I said, $1 per day, up to $10,800 per day, depending on the medication and coverage. Okay. Okay, for the full list of affected drugs, you can check out here this resource. This is a huge win for Medicare recipients who, what do you think? I think it's the greatest thing for people. Okay. These price cuts will have a huge impact on Medicare patients, especially those who rely on expensive medications. Here's how. Low out-of-pocket costs. Patients will save thousands of dollars annually, making treatments more accessible. Some may see reductions as high as $10,800 per day, depending on the medication. Okay, the next thing, improved health outcomes. Many seniors and individuals with chronic illnesses like cancer, osteoporosis, and substance use disorder will have better access to life-saving medications. Okay. Give me 1 second, guys. Reducing hospitalizations and complications. Less financial stress. Instead of choosing between medications and other necessities, patients can afford both, leading to better quality of life and less economic hardship. Protection from price hikes. The Inflation Reduction Act ensures manufacturers can't raise drug prices faster than inflation, preventing unexpected cost increases. This initiative is part of a broader push to make healthcare more affordable and accessible. It is a major win for millions of Medicare recipients who rely on these medications to stay healthy. Okay, folks. What are your thoughts? These Medicare price cuts mark a major shift from past pricing strategies. Historically, Medicare did not negotiate drug prices directly with manufacturers. Instead, prices were determined by pharmacies, benefit managers, and health insurers, often leading to higher costs for beneficiaries. Here's how the new approach compares to previous strategies. Direct negotiation. The Inflation Reduction Act now allows Medicare to negotiate prices for certain high-cost drugs at a first in U.S. history. Previously, Medicare was prohibited from negotiating prices under the non-interference clause. Price gaps. Medicare now sets stationary statutory upper limits on negotiated prices, ensuring they don't exceed a certain threshold before this drug price prices were largely dictated by market forces and manufacturer pricing decisions. Inflation based on adjustments. The new policy penalizes manufacturers for raising prices faster than inflation. Previously, drug prices could increase unchecked, often leading to skyrocketing costs for Medicare recipients. Expanded coverage. The negotiated prices apply to Medicare Part D drugs starting in 2026 and Part B drugs in 2028. Before this, Medicare paid for drugs based on commercial pricing models. Which often favored pharmaceutical companies. This shift is expected to save beneficiaries thousands of dollars while making essential medications more affordable and accessible. What do you think about this change? When it comes to senior and Medicare prices, I think they should have done it a long time ago, folks. For those who need life-saving drugs, like heart medications, things of that nature, like diabetic medications. People, if they can't get those, some die of heart attacks. Some go into diabetic coma without their medications. So it's essential for people to be able to afford things. They usually have to pick between food or surviving meds. They cut their medications in half, folks. When they can't afford, when it's either food or medication, seniors cut doses in half, which is dangerous. It's dangerous for some of those folks, to mess with their medications. At least this way they don't have to. They can afford both with this policy in place. That's my feeling on that. Thought I'd do a show on it tonight for y'all. I'll be back on with B shortly. Give me a little bit for B, please. For now, Gator Wellness, take care, folks.